Welcome to the Visser Podcast. I'm your host, Dr. Richard Visser. I'm a former Minister of Health and Sports with a PhD in medical sciences. I'm a published researcher, and a long time ago, I started my career as a doctor of chiropractic. Together, I want to explore wellness. I want to explore longevity to get you to the best health you've ever known. So join me on this podcast. Welcome to the Visser Podcast. This is episode 24, and this will be the first episode out of 3 that we're going to dedicate to stem cells. Okay, so we're going to, in this one, go over the basic of stem cells, and as we continue, we'll get into more complex subject matter. We'll look at what stem cells are being used for now, and more interestingly, what we're going to use them for in the future, and it's the near future. Okay, so you've probably heard of it. All the movie stars, top athletes, the wealthy, they're all going to these clinics and getting stem cells, right? For having better skin, anti-aging, looking younger, just also internally for their heart, for their, organs to decrease inflammation. We're gonna talk about all of that. And we're gonna talk about what's real, what's not real, and what we can do now. And look into the future, what are the possibilities. So before we start, we have to kind of look at what this all means. How do we put it in context? Well, I think, stem cells are the building blocks of our organs, playing a crucial role in growth, development, and regeneration of everything, of our body. Because of them, we're alive and we're changing continuously. I'll give you an example. If we look at our tissue cells in our body, and I'm talking skin, heart, intestines, lungs, muscle tissue, brain tissue, we see that our skin is new every month. New meaning every single cell has been replaced by a new cell every month. So your skin is not what it was a month ago. Your intestines, every couple of days, every cell in your intestines has been replaced, and so forth and so forth. Now these other organs take more time. The heart takes more time, but it's completely replaced. Okay, so in a year, every cell has been replaced. You are not who you were literally a year ago. Think about that. So when we look at, in a single day, you will replace 50 to 70 billion cells. Yeah, with time, we'll replace less frequently, and with less quality. This is what we call aging. There are several types of stem cells, so we have to, when we dive into these stem cells, I'm going to categorize it, make it kind of so we can oversee the process. So there's 2 basic categories. There's embryonic stem cells and there's adult stem cells. Okay, embryonic stem cells. These are derived from the embryos during the early stages of development. Okay, this is really where we talk about pluripotent and totipotent cells. These cells can turn into anything. I mean, we can build any organ, build anything from these. However, there's ethical issues, of course, because we're talking about embryonic cells, right, in development. So there's ways around it that we're exploring, but right now, that's off limits. Okay, so the second category, the one that we do use, is adult stem cells. And adult stem cells is not only adults like you and I, but it also means as soon as the fetus is born. So it's umbilical cord stem cells, Wharton's jelly, which we're going to talk about. It's the fluid that comes with birth also, which we'll talk about. So that's already considered adult stem cells, okay? And we'll look at the potencies because there's a big difference, all right, in potency and what we can do with it. So Okay, when we look at one of the stem cells, okay, we're going to start with bone marrow, because you've heard of bone marrow, transplant and getting cells from the bone marrow. First of all, with the bone marrow, it's kind of difficult. It's sometimes called for, but it's kind of difficult because they do have to put you under general anesthesia. They have to go to your hip, drill it, and then to basically pull out bone marrow to then process it into stem cells. So it's a big, kind of cumbersome way of doing things. But sometimes, that's the preferred method. Now, I want to give you an example of what stem cells do in a bone marrow. And this is just one example, okay? Because there's multiple things these stem cells will do and turn into. So if you were to go at altitude, like, you're living in Aruba, and you go to Medellin, which is high altitude, or somewhere even higher, Santa Fe, New Mexico, you would be up there and feeling miserable for the first couple of days. I mean, you would have lack of energy, lack of oxygen. Why? Because your red blood cells aren't adapted to that altitude and are unable to bring the oxygen to your cells. So you're going to be like freaking out. So what happens? Well, the kidneys signal with a hormone to your big bones, right, to the bone marrow, and say, listen, we need to produce red blood cells. The bone marrow then produces red blood cells, fills the blood up with red blood cells, and all of a sudden we can transport way more oxygen. We start feeling better, we start breathing normal again, and we're adapting to the new environment. This is just one simple example of how the body is amazing using its own stem cells. Okay, so, really what we're using the bone marrow mesenchymal cells is really for, like related bone disorders like osteoarthritis, non-healing fractures, etc. So that's kind of that, and we'll get back to that. Adipose tissue, so the fat tissue, they do liposuction and then get the fat out and then really start processing it to get the stem cells out of there. And that's, these stem cells can be used, for wound healing, reconstructive surgery, cosmetic procedures, basically the skin, regenerating the collagen, elasticity and everything, and giving us that youthful look again. And so this is some of the things that's used for. We have chondroblasts. These are cartilage producing cells that can be used in the treatment of cartilage related condition, also osteoarthritis. They have, shown repairing damaged cartilage and promoting joint health. So joint health, this is used. We have synovial fluid, contains synovial mesenchymal cells that are involved in maintenance and repair of joints. So that's great. Skin fibroblasts have limited differentiation capacity to other stem cells. They can become programmed into an induced pluripotent stem cell. So we can actually kind of, reprogram them to become the really pluripotent stem cells, which are much more powerful. So we'll talk about this a little bit later also. So when we look at, this part, we see that if we look at chronic wounds, and that's, people getting older, getting wounds that don't heal, in the US, it's 6.5 million alone. It's higher than most cancers. It's higher than most diseases. I mean, this is a big thing. And stem cells can cure this. Stem cells can be can play a massive role here. If we look at, the hair follicles, it's another example. It's very cool. We see that there's melanocyte stem cells, epidermal stem cells. We look at, the picture that's shown right now. Hair follicle stem cells, which are at the kind of the base of where the hair follicle is. And what we're seeing is that the hair kind of goes in a cycle of growth and non-growth, resting and growth and falling out and growing again. And these stem cells are the ones that activate it. Now, these stem cells are not alone. They are sitting in a bed of vascularity, so, little vesicles, vascular systems that bring blood and nutrients to the hair follicle. and also lymphatic system. Our lymphatic system is our drainage system. You know, you've heard of lymph nodes and our lymph system that drains everything from tissue. Well, these two elements are critical for the growth and maintenance of these stem cells. Now, the interesting thing about these stem cells is, you know, the hair stem cells is that for hair growth, of course, and we have treatments where we can induce more hair growth and keep them young. But we'll talk about that in the next episode. You got to leave some stuff on the table. But the interesting thing is this. So you have these stem cells at the base of your hair follicle, right? They're there. When you cut your head, or when you have an injury on your head and repair needs to happen, those stem cells are able to change into wound healing and repair stem cells that go and become skin. Amazing, amazing, just from the injury. They get triggered and they change what they are. Amazing. So when we look at this and we look at the key vascular system and we look at the lymph system, which is it's going to be critical in everything, in the whole body, in how we keep our stem cells. You got to think of our vascular system and our lymph system as the soil that keep, kind of the soil that keep the stem cells growing healthy and strong. And so we want that soil to be the best quality there is. Before we go to next, we have the limbal stem cells. And the limbal stem cells are specifically for the eye, for like cornea replacement or, cornea healing and everything like that, which we'll get into also. But here we go into my favorite one, which is Wharton's jelly derived mesenchymal stem cells. So Wharton's jelly is basically in story there. My son was born in 1999 in Santa Fe, New Mexico, which is actually, for you geographically challenged people out there, it's in the United States. Okay? Look it up. Anyway, jokes aside, at that point, I ordered a kit to have his cord blood stored at a bank. Now, in 1999, these nurses were going, what? What are you doing? Why are you doing this? Even the physicians were like clueless about this. So we had a beautiful natural birth. I went in, collected the cord blood, shipped it out, and it went to a bank where they hold it in minus 80 degrees Celsius. So, liquid nitrogen, for whenever he might need it. If he gets a disease in the future, if anything, he might need it. They can be cultured, and it's his, basically, stem cells. So at that point, we didn't really know what we were going to use it for. I mean, we had an idea, but we weren't able to do it yet, but we knew it was important, okay? So his stem cells I could use for the whole family, for everyone that has the same genes. Today, if you're thinking of having a child, or if you're having a child, don't miss that opportunity. It's such a simple thing. Before they throw out, the umbilical cord, have them take some cord blood and get it to a facility to store. A couple of bucks a year, and you have stem cells for your child and the whole family. So do it. Okay, so went off topic a little bit. Wharton's jelly. So this is what that was. So what we're looking at here is tissue regeneration, immunotherapy, treatment for certain autoimmune disease, neurological disease. I mean, this is powerful stuff. And it's powerful because it is strong. And I'm going to show you a couple of slides about this, how strong it is compared to the rest, and why this is the preferred cell to work with, stem cell to work with, whenever possible. And usually when we work with mesenchymal stem cells, Wharton's jelly, we do it in an IV so that it goes into your blood. And we're going to talk about it. It has homing. It does homing, so it basically searches out where there's inflammation in your body and goes and starts healing process. It's an amazing thing. And on a note, the first thing we talked about was the fetal mesenchymal stem cells derived from the source. These are also, it's from amniotic fluid and the placental tissue. These are also being explored for their regenerative potential. and in different disease conditions. But research is still up and coming here. Okay, so stem cells have revolutionized medicine and research in numerous ways. They offer potential treatments for a wide range of diseases and injuries. Here are a few examples. Regenerative medicine. Stem cells can be used to regenerate damaged, diseased tissue and organs. For instance, they have shown promise in repairing damaged heart tissue after a heart attack. Now, this is being used while we speak. This is not, future. This is right now. You have a heart attack, you have a stroke, you've had a stroke. Stem cells can be absolutely useful in regenerating some of the dead tissue that event has left behind. So it's one of them. It's one of them that's very important. Cell replacement therapy. As we know, stem cells can differentiate into specific cell types, such as neurons or insulin-producing cells. And the cells can be transplanted to replace damaged or dysfunctional cells in conditions like Parkinson's disease and diabetes. And there's quite a bit of research on this, and I'm including it in the description, how we are targeting the beta cells that produce insulin. So huge advances here. Drug development and disease modeling. Stem cells, especially the ones that we revert back to original stem cells, can be used to create disease models for better understanding disease and developing new drugs. So we basically take them and, like I said before, we'll induce pluripotent stem cells, iPSC, and these are adult cells that have been reprogrammed and reverted back to stem cell state, original stem cell state. So the use of embryonic stem cells has raised ethical concerns, as we talked about. So we're gonna kind of leave that out, but we can see that with the technology we have now, we can kind of create something similar with adult stem cells, the iPSCs. So where we can do a lot of research on. So quickly, I'll go through a list. On the regenerative side, for stem cells, we're looking at anti-inflammatory, and we know how important this is. Immunomodulation, the immune system. Keratinocyte and fibroblasts recruitment. Angiogenesis, extremely important to keep our blood flow optimized. Nerve regeneration, so any type of nerve degeneration that we're getting. Also, we know that these cells are able to pass through the blood-brain barrier and different other barriers. That's why they're so unique and they're so useful, because they'll go through cartilage, they'll go through every barrier that we have in our body to go to the healing site where they need to go to the knees, to go to the arthritis, to go to the heart that's inflamed, the cells in the heart that are inflamed, and start basically rejuvenating. Okay, on the rejuvenation side, we have immunomodulation, collagen synthesis, elastin synthesis. This is all, bringing back the tightness in your skin. A reactive oxygen species, ROS reduction, so that gets reduced, which basically reduces senescent cells, which are really bad, which we need to eliminate anyway, and it reduces our chances of getting cancer. And inhibition of MMC activation, matrix metalloproteinases in stem cells. Yeah, so they regulate that the stem cells don't, start freaking reproducing and turning into cancer cells, because that's what it is. It's an unregulated cell that basically starts reproducing and doesn't really care about when to stop and becomes its own entity, which is the cancer cells. This is to give you kind of the idea, the first idea of stem cells, the introduction. The future of stem cell research is incredibly promising. We can expect advancements in personalized medicine where stem cells are used. Right now, we're seeing countries like, and I'm just going to mention Mexico, Colombia, Costa Rica, Dubai, Turkey, some European countries, Switzerland, that are using stem cell treatments at a very high level. I think initially what we were seeing was PRP, and that is, the plasma protein. And the way we were doing that, and that was in the beginning, kind of, drawing your blood, centrifuging it, getting the plasma protein out of there, and then re-injecting it to the bodies to basically revitalize the area that needed to heal. So bringing, a concentration of cells to that area. Now, stem cells do the same, plus they go further and start regenerating. They cause the cells in that area to start regenerating themselves. So that's something that PRP can do. So PRP is really kind of a bit outdated. They're still using it. They're using it in combination with stem cells, with hair growth and other areas, but it's kind of, a bit outdated. Stem cells have surpassed the ability of what PRP can do. So it is an extremely exciting area. I do have to say there's a conflict of interest because, part of my team, my wife's team, is involved in stem cell production, training. We're training more than 1,000 physicians to use with the use of stem cells. So yes, just so I'm clear, my wife and I do have a stake in it, but it is still amazing. And this is also the reason I can bring it to you like this, because I've got insights. We have the labs, we have the scientists. We're doing it at all the levels. We have the physicians that are doing it, bringing it to patients, and we're seeing the results. And we're doing research. We're doing cancer research with this. We're doing also, stem cells were used in COVID victims to basically help them regain health, success. There is so much to do in this field, in this regenerative medicine field. So until our next episode, where we dive in a little deeper and we really start looking at what can be done right now and with what, okay? So join me to exploring stem cells. Subscribe, ring the bell notification, get your friends to subscribe. I need this channel to grow. Come on, let's grow this channel and let's bring some really exciting stuff. Thank you. See you soon.